I'm Chris Moeller, and thank you for joining me on my side. I'm a practicing dentist in the low country of South Carolina, specializing in the treatment of snoring. Did you know that 52% of the population of the low country, men, women, kids, have problems with snoring? So you've come to the right place. I've been in practice for 26 years with a heavy emphasis on the treatment of temporomandibular joint dysfunction for the last 15. This dysfunction, also known as TMJ, has a direct impact on snoring and sleep apnea. My goal for my snoring or sleep apnea patients is to identify the fundamental causes of their sleep complaint and to formulate a plan to get them healthy and back to the top of their game. I say healthy because sleep quality is a very important subject. The prevalence of obstructive sleep apnea in patients with congestive heart failure is 80%. For patients with type 2 diabetes, it is 72%. For patients with atrial fibrillation, it's 50%. For hypertensive patients, it's 35%. For patients with coronary artery disease or angina, it's 30%. Obstructive sleep apnea has risks, and those risks fall into 4 categories: cardiovascular issues, cerebrovascular issues, metabolic issues such as diabetes, and quality of life issues. Regarding the first 2 categories, cardiovascular and cerebrovascular, obstructive sleep apnea is 23% predictive of heart attack, and patients with moderate or severe sleep apnea are 3 times as likely to have a stroke over the next 4 years. Snoring itself is 50% predictive for obstructive sleep apnea. So when we are looking at snoring issues, we want to rule out or investigate these medical issues. In other words, it's not just the fabrication, custom fitting, and the adjustment of a snoring appliance. This is about an in-depth evaluation of your health status and identifying or ruling out factors that would suggest obstructive sleep apnea. This is equally as important as the snoring appliance itself. So to get started, just call the number listed on your screen.